This story came across my page and it completely breaks my heart because you would think to yourself, what does EDS, a neurosurgeon, and murder have in common? And you'd like to say nothing, but these three things have a lot in common. Does anybody remember the name of a doctor named Dr. Mohammed Shamji? Well, if that name sounds familiar and you're wondering why I have this patient's picture in here, the two stories actually collide and it's quite horrifying. A National Post article exposed a terrifying truth and that the only go to surgeon for EDS specific types of treatment in Canada was this physician named Dr. Mohammed Shamji. And he actually went to prison for murdering his wife in 2016. And absolutely, he should be in prison serving a life sentence. However, his patients shouldn't have to. The Canadian medical system abandoned every single one of those patients, and many of them are still struggling today. And this is where Tiffany's story comes in. As you can see, Tiffany has a condition called partial internal decapitation, and she needs a specific surgery that Canada does not offer. She's had 3 to 4 neurosurgeons sign off saying that she needs the surgery, and there are no surgeons that here in Canada that can perform that surgery. However, our healthcare system actually has a clause that says in Ontario or Canada, if there's a surgery or treatment that you need to have performed and it can be performed somewhere else, that the government will pay for it. So, for example, the Ontario government should be able to pay for her to have the surgery, right? Wrong. They've denied her 4 times. 4 times. And now they're planning on closing her claim for good. Essentially, the government is saying that she has to pay for the surgery out of pocket, and it's about $100,000 in the US. And of course, she's on ODSP, and she can't afford that. And what breaks my heart the most about this is the fact that Canada has given her first approval for MAID instead of a surgical date. Like, what are we doing? What are we doing here? And I'm not saying that, MAID doesn't have its place in our society. It shouldn't be the last case alternative for someone because our Ontario healthcare system is saying no to surgical intervention, knowing that we don't have people that can perform this here or that are willing to perform it. Why are we saying no? The Ontario government says that they cover out-of-country care if it's not available here, but for EDS patients, they use this loophole. And the loophole is that they claim that the surgery is available in Toronto, even if every surgeon has refused the case. And they require Canadian specialists to sign the papers, which she actually has specialists who sign these papers. So should we be in a situation where a system leaves you to decline for care but qualify for MAID? Help me make this make sense. If we can amplify our voices that maybe this doesn't happen to another person, but the decision on her behalf, it's not a choice. It's not a choice. It doesn't make sense to me that the government here is denying this form of treatment, although it says that we would actually do this work. So denying it, but giving her first approval of MAID makes me really, truly think what the government feels about people with disabilities. We would offer death instead of treatment. Something seriously wrong is here.